Okay, thank you. Hi everybody, and welcome to our BeActive webinar. It's part of the BeHealthy Webinar Series. We've got a really good lineup of people here today who are here to talk about different opportunities for physical activity and why physical activity is so important for you. So we've got Dr. Kim Gregory with us, Carl Stott, Michelle Howard, Helen Corrigan and Claire Williams, that are all going to talk about different things that are happening across Birmingham, as well as why physical activity is so important. Just moving on, the webinar today, obviously I'm doing a quick introductions and will overrun housekeeping in a minute. Then the bulk of the webinar will be the speakers running through their content. And then at the end, we're going to have a question and answer session. So if you have questions, there's the time. Just to note that Dr. Kim Gregory needs to leave after her presentation. So if you have any questions you want answering straight away for her, drop them in the chat and she'll pick them up before she leaves. If not, we'll get the questions emailed over to her and she'll reply that way. She's more than happy to do so. So just in terms of housekeeping, just a few things that will help with the smooth running of the webinar. So if you can, when you're not speaking, if you stay muted and turn your camera off, that just helps us save the bandwidth. Also, if you have any VPNs on your computer, so maybe NetMotion or Cisco, they're usually what you use to connect to a work internet work server. We've found that turning those off definitely helps as well. As we've already mentioned, we're welcoming questions and answers. You can either drop them in the chat function as you think of them. Whilst the question and answer session is at the end, you don't need to wait till then to raise a question. Sometimes they will be answered in the chat for you, or we'll pull you in to ask the question if relevant. Equally, we understand that not everybody wants to ask their questions in front of everybody else. So if you fall into that category, you can email us at the Healthy Brum email address, which is below, and we'll get back to you with an answer within a few days. Lastly, as we've already said before the webinar started, this webinar is recorded. We'll be using it as a resource for people that aren't here today, and it will be streamed on YouTube and linked to via the Birmingham City Council website for everybody who's not here, and for those that are, to use with people that they might want to spread the word to. Okay, so just before we get into the physical activity content, just a really quick overview of why we're doing what we're doing today. So Be Healthy is a concept that we've developed in the public health team at Birmingham City Council to support communities to reduce their risk of them becoming seriously ill from COVID-19. It consists of a series of webinars and also resources that help people to improve their lifestyle and health and well-being. So there's a downloadable 4-page resource that has a health checklist or Healthier You on there, and a getting ready plan that you can use with communities that you're working with. It has questions around physical activity in there, and it's available in up to 20 different languages, which can be downloaded from the link on the slide at the moment. In terms of topics that we've covered some COVID-safe webinars to start with, so hand washing, information on testing. We've also then moved on to why behaviour change, long-term conditions that are particularly linked to COVID. And now we're working through a series of things that can help you improve your health, and things that maybe you could do a little bit less of that might improve your health too. So today we're talking about physical activity. For those of you that know me, physical activity is something that features quite strongly in my life. I'm often found pounding the pavements outside with my music on, probably far too loud, but it's my escape, and it's helped me deal, and it's especially helped me cope with the craziness of working in public health during the last 6 months, I think it's fair to say. So before, I think that's all there is to say from the introduction, so it's time to move on now and introduce Dr. Kim Gregory, who's going to give an overview of physical activity and COVID-19. So welcome, Kim, and over to you. Thank you.
Okay, well, thank you very much for having me. So yes, I'm a consultant in sports and exercise medicine, and I run the sports and exercise medicine service at UHB. Let's come up the next slide, please. So what makes us healthy? Physical activity is a fundamental element of this, but how easy is it for us to actually engage in physical activity is actually impacted by many of the factors shown in this diagram. particularly looking at the individual lifestyle factors, social and community networks, our working environment, our education, and all the associated conditions linked alongside this. And just to join the party, we now have to deal with COVID-19. Can I have the next slide, please? So risk factors for COVID, which I know have been covered well in the media and also in other webinars, are age, gender and ethnicity. None of these we can actually modify, however. And then in terms of more medical risk factors, the smoking, obesity and management of long-term conditions such as diabetes, cardiovascular disease, chronic renal disease, which there have been webinars within this series looking at. These are all modifiable to a certain extent. Smoking and obesity is a lifestyle choice for the individual's lifestyle and decision making, but also there is a degree of what availability and access to NHS and healthcare support. If we can optimise that access to healthcare, remove some of the barriers, educate to support positive decision making relevant to that individual and that community, and it's particularly important in a diverse population such as Birmingham's, hopefully we can then get them to increase their physical activity, which is that important modifiable risk factor. But for it to work, it's got to be accessible, it's got to be regular, and it's also got to be enjoyable, because otherwise we're not going to continue to do it. And if we get all of these elements together, then we should get some positive social and community development resulting as a result of it, which is one of the underlying aims of these webinar series as well. And following on, the speakers in this webinar are going to hopefully give some good examples of what's out and about. Can I have the next slide, please? Okay, what's the problem? Well, the problem pre-COVID was the fact that actually we're not that active as a population, and the data's there to back this up. So 1 in 4 women and 1 in 5 men in England are classified as physically inactive. So that means they're doing less than 30 minutes of moderate exercise a week. And then if we look at sedentary activity, so largely sitting down and not really moving around, this gets particularly bad at the weekends, increasing to 40% of men and 35% of women. Can I have the next slide, please? So currently, we've now got an inactive population to start with, and also we've got COVID, and COVID potentially has further challenges to physical activity engagement. So there's increasing anxiety. Understandably, there's people have the fear of getting COVID. There's social isolation. So those that used to exercise, perhaps go to classes, to spend time with others, are not able to do so, particularly during the lockdown period. People and grandparents are not able to play with their grandchildren. Young mums meeting up and exercising with their newborns. Shielding, social distancing, although this can be mitigated by the fact that we could go outside, and working from home. And there have been several studies showing a significant decrease in step counts, and many of us will have active watches or iPhones that are monitoring our steps, and there's been a significant decrease in steps since we've had lockdown because we're not going out as much. Park runs had a significant impact on increasing how many people go out and walk or run each week. Closure of the gyms, dance studios, pools and playgrounds all are going to impact and make it even more of a challenge. And also there's been an impact on public transport use too. But this could also be a positive in terms of people walking more or cycling, and that's a lifestyle decision, or are you using the car because you feel safe? And the positive thing is that outside, if we're outside, actually we've got good ventilation, and that's one of the risk mitigation factors for COVID. One of the really, really positive messages that's come out through COVID and lockdown was the fact that exercise was considered an essential activity. And we've been encouraged to maintain our physical activity levels. In essence, we're actually dealing with 2 pandemics. The current one with the high risk, the COVID, very instant and very impactful at the moment, but there has been a background slow burning physical inactivity pandemic, and the 2 now have just merged. And therefore, it's really important that we think about supporting health literacy so people are aware of the reasons behind their lifestyle choices and they know where to seek support if they decide and are in a position to be wanting to change those. Interestingly, one study looking at UK, American and Australian data using Google Trends actually noticed that if there's queries online for the topic of exercise, workouts and fitness training in all of the countries massively peaked and surged within the first 2 weeks of lockdown. It has subsequently declined, but it's still much higher than it was pre-COVID, which again is a positive situation. Can I have the next slide, please? So, why is physical activity so important and across the lifespan? This is a nice summary diagram, one of many available, that shows the various positive health effects of physical activity. This could be all-cause mortality down 30%, breast cancer down 20%, coronary heart disease and stroke 25%, depression 48%, something that we've seen within the media has certainly increased and been more of a challenge for those that suffer because of social isolation and the impact of the pandemic currently. And also it has a significant impact on type 2 diabetes, reducing it by 35%, which I know in one of the previous webinars has also been touched upon. This shows that it's a massively important modifiable risk factor for not just these times of COVID, but general overall health. When I do a presentation on physical activity, I nearly always end up quoting Professor Robert Salas, who's involved in the exercise as medicine campaigns in the States. And he always said, if there's one prescription that could prevent and treat dozens of diseases, such as diabetes, hypertension and obesity, would you prescribe it to your patients, your colleagues or your friends? Of course you would. And that one prescription is exercise. I would always advise people to use the word physical activity rather than exercise, because I think it's much more wider and is also can be seen as one of the barriers to physical activity participation if people just constantly think about exercise, because often it's linked to going to the gym and more targeted sports. It also has much wider benefits than those presented on this slide. So improved learning and attainment through younger age groups and throughout the lifespan, productivity in the workplace, self-efficacy, better sleep and social skills development. Can I have the next slide, please? So there are several evidence-based resources out there for us all, clinicians and non-clinicians, to help support individuals who wish to become more physically active, be that managing their chronic diseases or just for general health purposes or because they have an interest. They're freely accessible and all evidence-based. This is an example of moving medicine, which is one of the ones that I personally have been involved in, and I've purposefully put up the evidence base and showing the links for depression for mental health, as this is very topical at present. So it does improve cognition, mood, self-confidence, again, sleep, can help reduce social isolation. I appreciate in current times this has been quite difficult to maintain, but going for a walk outside has been encouraged and does reduce your risk being outside in a well-ventilated area. There's also Motivate to Move is another evidence-based resource, and there's plenty of other resources such as these webinars are creating to also help support people, support others, friends, family, to increase their physical activity. Can I have the next slide, please? So, as I said, use of physical activity in conversation rather than exercise is always beneficial, because that is easier to link into active living, active travel, which is really important. And it's an opportunity, particularly in COVID, to have a positive impact on physical activity behaviours if we can walk or cycle to local shops, support local businesses. And if we can maintain this long term, that would be a fantastic win for the population. But it does require that ongoing cross-sector collaboration to ensure that we have the infrastructure and are able to do that. And hopefully later speakers will be able to touch on this further. And also being able to do that within across the lifespan and with ethnic diversity reflective of our local population. You've got active recreation, that could be walking the dog, and then you have got the more structured, typical exercise-linked active sports, be that informal or be that organised sport. And these all link into the Chief Medical Officer's guidelines of physical activity. The commonly quoted cardiovascular side of things is 150 minutes of moderate intensity physical activity. But this is what we're aiming for. It's not that everybody needs to start at this point. There's no reason why almost every person can't start to increase their physical activity. Those with significant multiple complex comorbidities are going to need to seek advice and support from their medical professionals to balance the impact of their symptoms, their medications against that physical activity. But even a small amount of exercise can have a significant gain. And as I've said before, it needs to be regular and it needs to be something that you enjoy so that you start to do it. There is a consensus paper which is currently being developed on the risk of physical activity for people with long-term conditions to help support people and try and mitigate some of these risks. So hopefully when that's there, that again will act as some support for some of those barriers that do arise. The Chief Medical Officer's guidelines shown are the cardiovascular ones, but we're aiming to build strength and improve balance, and that should be at least twice a week. Just being more active and minimising our sedentary time. There are also lots of other Chief Medical Officer's physical activity guidelines for different populations, including pregnancy, postpartum, and then broken down into the under 5s, adolescents and children, and older adults, which are freely available. Can I have the next slide, please? So this graph shows very clearly with all-cause mortality and daily physical activity duration that actually you don't need to do a lot of even quite moderate physical activity to gain a significant benefit in overall health. Can I have the next slide, please? So what do we mean by intensity of exercise? What is that moderate intensity of exercise versus vigorous? This is a nice summary slide which shows that sedentary is not really moving. You're working at a desk most of the day. Quite light activity is putting the rubbish out, doing a little bit of yoga, doing some cleaning around the house, and that will get your heart rate up, will get your respiratory rate up, and will get you using more energy. That moderate, that critical one that we need to be aiming towards increasing towards 150 minutes is walking, cycling, shopping, and then you get the more vigorous activities, which could be dancing, playing football, swimming, and then very vigorous is your weight exercises. And it's important, if you are not particularly active when you're starting out, that you gradually work up through this and gradually increase things, and listen to your body and listen to the reactions and seek support if you've got any concerns or develop any new symptoms. But it's generally safe for most people to start things. Can I have the next slide, please? So if we're staying active during COVID and we are restricted because of the infection control and public health guidance, there's a lot that you can actually do at home that doesn't cost a lot of money, doesn't require you to go to the gyms. So examples here are the kettlebells and free weights or resistance bands, but equally you could use a can of whatever vegetable or soup you have in the kitchen cupboard. You could use a book, a heavy book, an item around the house. It can all be quite easy, it's quite straightforward, it doesn't cost anything, and you don't need much space. Resistance bands, pairs of tights do very well, or a towel can be equally as effective. So there's lots of different ways that we can do this at home. If you're watching TV, get up and change the channel rather than relying on the remote. Use the advert breaks to be a little bit more mobile. Can I have the next slide, please? Okay, so physical activity has a place in supporting several elements of COVID, as well as the overall physical activity benefits of health, which I've presented. It will significantly impact reducing those modifiable risk factors for you getting severe COVID-19 illness. it does have a place in supporting rehabilitation for those that have recovered from the active infection but are struggling with some of the post symptoms and returning to full fitness. And also this concept of long COVID for those that still have long-term persisting symptoms and are going to require longer support in getting back to the activities that they were doing beforehand or starting new ones. Physical activity is important, but it needs to be individualised against the person's wishes, the person's medical conditions, the various individual barriers that they face to being able to achieve physical activity. It does need to be regular if you are going to get the benefit. So therefore it needs to be enjoyable, otherwise you simply won't stick at it. And it's physical activity, it's not going to the gym, it's not doing regular sport, it could be walking your commute to work. But equally, you have to allow your body to recover, and sleep and rest periods are important as well. So it's getting the balance. And that key thing is the concept of a boom or bust approach to physical activity. That needs to be avoided. What you're aiming to do is to have a consistent approach and not do lots so that you get completely tired and then don't want to do anything, or you pick up an injury. It's getting it sustainable. So again, individualized, regular, enjoyable physical activity has a multitude of health benefits in general terms, and also in the time we currently face with us battling this COVID-19 pandemic. And can I have the final slide, which shows the references that I've used for these resources? And I'd also like to thank my registrars who have helped with some of the slide formation and access to some of the pictures. Thank you very much.
Thank you, Kim. That was brilliant. Thank you. And it's so true. There's so much strong evidence of how good being physically active is for you. And I think the key that you mentioned at the end is that you've got to enjoy it. You've got to find the thing that you enjoy, and that way you'll be able to create a habit that might stick with you. So yeah, that's really, really useful, and so much information for everybody there. Are there any? I haven't seen any questions in the chat today. Are there any questions that anybody has now, just before Kim leaves us today? And if not, we can. It doesn't look like anyone's rushing to type, but I'm sure people have got are thinking about all the things that you've said, because there's so much information there. If people do have questions, we'll email them over to you afterwards. So thank you very much to you and your team for pulling all this together. Thank you. Okay, so moving on to our next slides, really. We've talked now about why physical activity is so important and how it's important to find something that suits you. What we thought would be really useful for the rest of the webinar is to talk about local opportunity and provision, things that are available in Birmingham for people to take part in. So first up we have Kyle Stott, who's a member of the public health team, and he's just going to talk about the Wellbeing service BeActive. So over to you, Kyle. Thank you.
All right, thank you, Stacey. Can you hear me okay, everybody?
Yes, we can.
Great stuff. I think Dr. Kim Gregory there set the bar very high, so I have to live up to expectations now. I just wanted to talk to you very quickly about the Wellbeing service, which is delivered by the local authority, by Birmingham City Council, and specifically about the BeActive offer that they have. The BeActive offer in a nutshell is about free gym, free swim, and some classes as well at certain times of the day. There are other things as well that my colleagues Michelle Howard and others will elaborate on from the Active Wellbeing Society, but I'll let them do that, and I'll just stick to our wellbeing centres at the moment. There's a reduced service currently being delivered at the following wellbeing centres in the city. So that's King's Standing, Handsworth, Nechells, Shard End, Smallheath and Saltley. And in the slide there, you can see that they're all highlighted in blue. So if you do click on them, there is a hyperlink embedded, and it will take you straight to any of those particular wellbeing centres. I am pleased to say that even though COVID really has had a significant impact on the ability of providers to be able to actually provide a service or a set of services, the wellbeing service, as well as other providers that you'll hear from today, have been able to continue to provide some level of support. The following services are available. at all of those wellbeing centres that I've listed and their exercise classes, you will need to check with the centres what is actually available and what they're delivering. There is access to cardiovascular equipment, so if that's your preference, so static bikes, rowing machines, walkers, and treadmills, etc., and also access to resistance equipment as well, so weights machines, etc., which, as you've heard from Kim, it is important to have a balance of weight bearing activity as well as cardiovascular and other activity as well. Unfortunately, there's no local authority swimming pools that are open at present, mainly due to repairs that need to take place on them that have appeared over the shutdown because they've not been used during the lockdown. And unfortunately, when they've come to be restarted, it has actually created some faults in some of them. It is anticipated, though, that those swimming pools will be online and usable by Christmas 2020, so by Christmas this year. But I would encourage you to get in touch with your local centre and actually ask them for an updated timeline on that. One really important piece of information, or a couple of really important pieces of information: all centres operate a booking only service. You can't just turn up like you used to with your leisure card, unfortunately. And that's due to the COVID risk assessment and the COVID, it's extremely robust. And they will not and cannot deviate away from that, the centres. You will not be allowed access otherwise. But the good thing is that that system is actually there to protect you and others, just to protect customers and staff. And also, as we know, in the way that COVID is transmitted, it also protects others in your family and other and wider. You can book online, you must book online or by telephone. So just give them a call or book online. And if you don't know where the number is, or you don't know how to book online, again, go back to any of those centres that are highlighted in blue on this slide, click on that, and it will take you to how to do that. And unfortunately as well, due to COVID restrictions, no centres are currently accepting new inductions at this moment in time. And I am aware that these webinars are actually designed to increase knowledge so that providers, community champions, etc., people who are listening can better understand what's out there and can encourage people to try new things. What I would say in this instance is, if you are a community champion or a provider or somebody that can reach out to others, do tell them still about the wellbeing service and what offers are available, because anybody with a leisure card can and should really, if they're able to and they want to, take up the offers that are actually there at the moment. So what I'm trying to say is all is not lost. The centres, because of COVID restrictions, aren't accepting new inductions, but we would encourage people with a leisure card to I suppose, as Kim said, look at variety with reference to being active and make it enjoyable. And more often than not, when we're trying to make activity enjoyable, it's about a diverse range of different activities. And the wellbeing service offer will actually assist in increasing that diversity. So Stacey, I think I'm done there, to be honest. It's very concise, the information I've provided, but I think, yeah.
Thank you, Kyle. No, that's great. I think it's really good to hear that there is a service operating through BeActive at the moment and what it is. So as Kyle said, for those of you working with communities, there's a clear call to action there. So if you're working with people and they have leisure cards, then they can book. They can go to the centres. They just need to book before they go. So yeah, that's something that you can certainly share with communities you're working with. So thank you very much, Kyle. Okay, so moving on to the next service that we have here, we have the Active Wellbeing Society here. So we have Michelle Howard and Megan Smith with us today, who are going to talk about the activities that they run, and most of these are more community-based, so different, something different that might catch your people's attention that you're working with. So over to, is Michelle starting or Megan? I'll leave it to you.
Yeah, I'm happy to start.
Okay.
Is my camera
Thank
working
you.
now, Stacey?
Yes, you're here. Hi.
Oh, amazing. Yeah, great. So Yeah, my name's Michelle Howard. I'm the Director of Healthy Communities at the Active Wellbeing Society, and both myself and Megan, who's our Delivery Programme Manager, are just going to talk a bit about some of the services we're offering, the social prescribing model that we've got within the Active Wellbeing Society that's very much run in partnership with others in the city. And then some of the insight and learning we've gained pre and during COVID about barriers to being active, and the types of activities people would like the opportunity to access. And it kind of follows on nicely from Kyle's thread about the BeActive programme, that we are very much grounded in removing barriers to participation. So we have always had the guiding principle about actually giving people the opportunity to be active for free, recognising there's multiple barriers people face, and cost, certainly in an area like Birmingham, and for many that face the greatest inequalities, cost has definitely been a barrier. And we've done a lot of research with the BeActive service and the Wellbeing service, and obviously coming out of the local authority in 2017 and establishing the Wellbeing Society around understanding those barriers. And pre or post COVID, or during COVID, should I say, cost still remains one of the greatest barriers that many of our citizens face. So if you could just move on to the next slide, just a bit about us. The Active Wellbeing Society is a community benefit society, and our roots are very much grounded in giving people the opportunity to be both socially and physically active, but very much recognising the social connections are often the thing that actually helps people build that self-efficacy, that sense of agency, to be able to then take the steps into being physically active, even if they're pre-contemplators and they're not even in a space where they feel like they want to take that step into physical activity. I know Megan's going to talk a little bit about some of the other projects like the Bikes project, but I've put up some of our logos about the types of initiatives we run. So we run things like the Big Feed programme. We operate community cafes, which are kind of pay as you feel cafes, so free for service users if cost is a barrier. And we run them across the city. So we're operating out of places like Walsall Heath Farm. Again, we can provide information about where these cafes take place. We also, as part of the Big Feed team and part of the city's emergency response work, actually worked with the council and other partners, 80 plus partners, as part of the Brum Together movement, dealing with the emergency food response during COVID. So actually delivered 60,000 food parcels to households throughout the city, as well as 18,000 hot meals. So there's been a huge response in the city, I think, whether it's about supporting people to live well in and around their homes and actually helping to remove barriers to just being healthy. And that's food as well as activity. We've got the Listen and Connect service, which I'll touch upon, has grown out of the befriending and telephone support work we've done during COVID. And again, a lot of that was about actually some of our staff, whether it's the social prescribers or others that might have been delivery staff pre-COVID, actually adapting their model of support and being able to help people over the phone, offering advice, guidance and support to kind of be active and live well. Then there's the Active Parks programme, Bikes and Streets, and we've got more recently the Share Shacks. So we'll touch upon some of this further into the presentation. Next slide, please. So social prescribing, I mean, I didn't want to take for granted that people understand or know what social prescribing is, but it's certainly a term that's grown in prominence in the last few years. But for many of us, it's what a lot of people have been doing anyway, which is about offering people options to improve their health and well-being that aren't necessarily a referral into a health service or a prescription. So it's the stuff that might actually help people improve their mental and physical well-being. And it can be a whole range of things. It might be that people want debt and benefit advice. We've certainly seen a huge increase in that during COVID. Access to food support. It might be about actually people who just don't have the confidence or haven't been active for years and actually wanting that advice, guidance and handholding into services within their community. So social prescribing has grown in prominence, certainly with the announcement of the NHS England funding for link workers. Primary care networks, which have now recently formed, all have a commissioning budget for their own social prescribing link workers. And if we just move on to the next slide. TORS works with up to 50 practices in the city, running the social prescribing service for practices across Birmingham. That's just a map with our team, and it shows you kind of the coverage we've got from North Birmingham right through to South Birmingham. But we're not the only provider of social prescribing, so there's some other great partners in the city that do link worker provision as well. So Gateway, Whitton Lodge, Health Exchange. There's a number of providers in the city working with practices and primary care to support GPs to help patients with, I know Kim put it on her original slide, the wider determinants. So there might be many barriers people face to actually living a healthy and fulfilling life. And actually, they're not always the things that your GP can help with. They might be one part of the puzzle, but often people land at the GP's doorstep with a whole range of issues. And social prescribing has got a huge role to play in supporting people who are isolated, who are vulnerable, who might want to take steps into a healthy lifestyle, but need some advice and guidance about what's actually out there in their community. And that's a really big part of what our model's about and what we've been working with our practices to co-design. So again, with any of these services, they're on our website, but we're happy to have conversations as well about what this looks like. And if you're working with partner organisations or patients or citizens, whether they're covered by our link workers, and there might be work we could be doing together to support them. Next slide, please. So the Holistic Interventions Programme is a programme, the Sport England funded Active Communities Programme. One of the work streams that comes out of that is holistic intervention, social prescribing. And that's been very much a piece of work that we've worked in partnership with Sahili in the city, who also have a lot of experience of supporting people who are pre-contemplators and taking some of our learning from traditional exercise on referral programs, that you might have a number of people with chronic and long-term conditions, with multiple barriers to being active, complex lives, facing isolation, loneliness, confidence issues, and actually just telling them all the benefits to their health they might get from being active. We've learned over the years, whether it's on the commissioning side or the provider side, that actually it takes a lot more than that to hold people's hands, to actually build the confidence and the sense of agency to take that step into physical activity. So we've been piloting and working with Sahili, GPs and primary care to do the bit about the building block in between, the bit about, well, what if someone's not ready to take that step into activity, but they would be willing to do things like coffee mornings or social activities or art and craft classes, and then building that sense of peer support and actually designing and timetabling in physical activity opportunities that people can then try, without the starting point being, you have X, Y, and Z condition. Did you know you should be more active? And here's a list of things you can do, and then expecting people to take that step. So we've done quite a lot of work with our GPs and with Sahili to pilot and test the model, with some really interesting findings as well. So this is something that we're building on with our social prescribing model, the recognition that actually not everyone's ready to take that step to being active, but it is important that we work with people to actually just create that sense of connection with others. Next slide. So I've put here, sorry, the font's a bit small. I've put here Omnia Practice is a practice in East Birmingham. It's one of the many practices we're working with. But again, based on looking at the site, the premises, the fact that we know a lot of patients trust their GP, but they might not know a lot of third sector providers in the city. It might not be a trusted brand. We looked at whether we could start using GP practices as community hubs. And we literally did things like walkarounds, looking at things like the partners room, which would normally be hosting meetings, or the outside space, which is normally a car park. But actually, the practice is open on a Saturday and the car park's empty. And then we went around the back and we're looking at things like, well, you've got a courtyard here. And we started to kind of we did some consultation, which again, I'll link into in a minute, about the types of things patients would like to see, and also the kind of trust element of your practice. And we found that over 3/4 of patients said if something was in or around their practice, it gave them a sense of confidence and safety and trust. So we've begun running things like learn to rides, walking groups, DIY, women-only DIY sessions based on what's come out of consultations, but actually designing activities in and around practices, and then helping handhold people to move into community-based settings and activities, recognising, going back to the point I made, there are lots of barriers, confidence, trust, etc., being one of the main ones, but actually more and more during COVID, anxiety as well. We surveyed over 2,000 patients, and this was something GP practices very much supported us with across the city. And that was literally not going to your kind of patient participation groups, but actually sitting in surgery waiting rooms and talking to people maybe that were least likely to engage, not your usual suspects that respond to a consultation invite or opportunity to do this work. And it was something that our practices were doing the social prescribing with, were really keen to do, to hear from the patients what type of activities they would like to have access to, but also understand, well, what are the barriers to being active? So if you move on to the next slide, sorry. So just some of the findings from this, and Megan's going to talk in a minute about some of the findings during COVID as well. But actually, unsurprisingly, in terms of barriers, things like lack of time, we know that's become more of an issue in COVID. The cost of things to do, going back to Kyle's point about why things like the BeActive offer is so important. Lack of things in people's local area, things like childcare. So we were working with some of our GPs to look at things like, well, we could be running intergenerational gardening activities. It doesn't always have to be activity that is focused on the adult. Where are the opportunities for people to turn up with their children and be active? And then in terms of the types of activities, there was a really strong pull for low impact physical activity. And I think some of the things that we looked at doing, so we've got here walking, Zumba, yoga, Pilates, but actually the coffee and chats. So nearly a quarter of the respondents said they just want somewhere where they can turn up and connect with other people. And for things like the low impact, we found that chair-based exercise activities are things that we were able to start running in GP surgeries. And I mean, I should have included one of the photos, but we've got some really great images of where rooms would have just been partners' rooms for meetings in GP practices, now set up to do things like chair-based activity for people that would probably not go and access something in another type of setting, but have got that confidence because they're regular attenders at their practice. So I'm just going to hand over to Megan to talk a little bit about some of the findings during COVID from some of the insight work we've been doing. So next slide, please.
Yeah, so obviously Michelle's just spoken about all of the things we delivered or were putting together to start delivery before COVID, and we, you know, more than ever saw it was important to adapt and listen to people about new challenges that they faced, although similar to the challenges they faced before lockdown. And we completed a consultation up to nearly 300 people through our Listen and Connect service. And the results and the findings from that survey speak to the latest Sport England insight around the barriers around childcare and just general care and commitments increasing and lack of space. And more importantly, the lack of funding, and that just not affecting people who it may have used to have done, people who have become unemployed or been on a furlough scheme, or actually just the general worry of not maybe not having a job or the disposable income they used to have to be active and put that money into their physical activity levels, which is obviously now more important than ever. So that was really important to us. And also what was striking from the survey that we did was around people's safety perceptions, and that again linked in with the insight from the Sport England piece. And it doesn't mean necessarily people are afraid to go to the park, for example. It's around the contracting COVID-19, and they're really fearful to come out and put themselves at risk. So we've done a number of things in response to this to support the community to feel safe with returning to activity. And we've developed a framework to encourage the safe delivery of the return to what we can do with regards to physical activity, predominantly outdoors at the moment, and in line with the new guidelines for Birmingham as it stands. Next slide, please. So one of our responses was around adapting our offer and basically putting it online. So you can see a picture around the virtual wellbeing activities. This is just a snapshot, really, 1 week within the middle of August. And they were really popular, and the types of activities changed throughout COVID. And we saw a shift from kind of the group exercise stuff to more of mindfulness and yoga and Pilates, and people were more interested in their nutrition, etc. So you can see there just the types of things we offer, and we still do offer. But one thing that was really important was to the theme works. We know that, you know, walking has always been popular with our participants, and we've twinned that with our befriending service and restarted COVID safe walks. So with the patient groups, they're doing it in bubble groups, and we've got a few that are happening around the city in various parks. But also Taz, one of our deliverers that you may all know, actually, he's very active on Facebook, and there's a link there that you can look at the theme walks, and they're trying to make it accessible to people at their own time. So we didn't want it just to be, oh, you can do it now, only when we're live. It can be, you can look back at that and go and walk and find out about spaces that you may not have known about. Next slide, please. I think we're back to you, Michelle, actually.
Oh yeah, just following on from what Megan said, I think one of the things that we've had to learn and adapt really quickly, and I know a lot of other organisations have done it brilliantly as well, is, you know, we can't just do what we were doing, and we can't wait for the world to go back to normal, because the world isn't going back to normal anytime soon. So actually, how do we adapt and change and support people? Because the need for this type of support has never been greater. And actually, you know, we have staff with a commitment and a real sense of duty to want to help. And so, you know, taking the learning from the telephone support work, it's been very much the kind of driver behind our Listen and Connect service that launched at the beginning of October. And again, we'd flag this if you're working with groups or citizens or people that would benefit from this. It's up to 12-week support program. It's telephone support, advice, information, guidance, but it's also about developing conversations again about how to live well in and around your home for those that maybe can't be going out and aren't going out yet, but also about building confidence and building a relationship and trust with people who might then support you to take those steps outside your home. Because I think, as Megan said, and certainly the Sport England findings back this, and Kim's alluded to it as well, there is a great amount of fear, and there's a real danger that the level of fear to come out and be active, if it's not addressed, then have a huge problem on our hands in terms of public health. If it is all about the fear of COVID and we're not addressing and supporting and helping remove the barrier of actual fear to help people get active, the ramifications of that, as we all know, are huge. So services like the Befriending and Listen and Connect, there is much about, okay, so if you're not in a position yet where you feel you can leave your home, what can you do within your home? And we've been, and I know Kim touched upon some of these, but resources such as our own, like the virtual offer, but there's Sport England's stay in and work out resources, the Public Health England's kind of active at home booklet, some of that stuff in terms of just chatting to people, and they wanted ideas, they wanted to know how they could be active, they wanted suggestions. So even from the telephone work, being able to then post some of these resources to people who couldn't get out and can't get online. We have to be more creative. So yes, we have to still have our offers that are out in communities, and like Megan said, develop our guidance and constantly review the guidance and have the assurances and the test and trace in place, which is what we've been working really hard on for the last couple of months. But we also have to adapt and recognize there's a real need to support people in different ways, whether that's telephone, whether that's virtual. And I've just included there an image of which Megan's again alluded to, things like the walking groups we're now running, where actually there might be people that have mobility issues, face a number of barriers. But one of the things we're learning through the telephone support work, and we've worked with over 6,000 individuals over COVID now, is there's absolute desperation for human contact and connections in a safe way within the guidance. So people are really desperate. You know, some are very scared, but actually a lot of people are really desperate to have that opportunity to be active and connect to others. And maybe the physical activity benefits to their various conditions won't necessarily be the driving force. For many coming out of their homes, it's that want to connect with others again, because people have spent 7 months indoors and people have been very afraid. So I think if we can design interventions in a way that provides assurances for people and enables them to know that we have their safety at the forefront of everything we do, we need and we have a duty to kind of help people come out and be active and connect again. Next slide. Sorry.
Yeah, I think we're going back to me, Michelle. Thank you. Yeah, I didn't touch on it actually, but Michelle just reminded me we've developed a framework at the Active Wellbeing Society in partnership with the public health teams in Birmingham and Solihull, and with guidance from the group exercise experts in Sport England around that really provides guidelines for staff, instructors and volunteers to mitigate risk, to provide track and trace support. And we hope really that we were able to support community groups that are looking at restarting, delivering how to do that safely, and supporting them with this framework. So just to touch on that, really, we can share that more widely a bit later on. We were asked to talk about our cycling support services. I probably could do a whole presentation. I've got colleagues on the call from the bikes service actually around the offer that we have in the city. And just to really touch on the Big Birmingham Bikes project, it was a scheme that gave over 7,000 free bikes to overcome the cost of cycling. People don't have a bike, they can't cycle. So that was one of the free giveaways that we did. And there's an infographic there that touches on some of the outcomes from that, which are huge and are exhausting. Really, I can't go through all of them. But, we do have other support that I'm going to touch on in the next few slides around teaching people, giving people the skills to ride, as well as giving them a bike, and also teaching people how to fix their bikes. So next slide, please. This is a slide about our response again in COVID. We obviously used to deliver a lot of lead rides, a lot of lead cycle rides, and we basically couldn't do that for months and months. We've just started really now doing bubble activities and lead rides again. But we were really keen to use the bikes that we had to help the key workers. So this is just bit of a case study really about one of the key workers and the 82 bikes that we loaned to them to help them travel to work. In the thick of the pandemic, people were advised not to use public transport, so it was more important than ever to give these people the access to get to work safely. And more importantly, the half of the bikes the key workers were able to keep because they fitted into our framework to be able to receive a free bike. So next slide, please. So these are our Cycle Fix It cafes. So this is a really exciting project that actually we were just about to launch in March. So we weren't able to, but now we have two cafes around the city, and they're based out of our share shacks, which you can again provide more information on. They offer people the equipment to fix different things, whatever that is, maybe the household, in the household, or their bike's equipment. So there's Sean here that is fixing a bike. So at the cafes, like I say, we've got 2 slides, and the ideas and the ethos is around, a lot of people have a bike, but the barrier to them riding again is that they were broken or had a puncture. So Sean is there at the site to offer minor bike repairs and maintenance, but more importantly, to teach people how to do that themselves. And the share shacks that we launched, I think last week, they provide people to learn new skills around and share skills that they have. But this is one of our exciting projects because it's already enabled people who have a bike to then go back riding again. The opportunities are just listed on there. So one at Ladywood, outside Eat, Make, Play every Tuesday. I have got the times, I'll pop them in the chat in a second. And the City Farm on every Wednesday. We did provide, it was on first come, first serve kind of booking process only at the moment, but actually you can just turn up now. We've got the social distancing safe, you can safely turn up and basically have your bike fixed and learn how to do that. They're also piloting from the share shacks soon a bike recycling and fixing. So people who outgrow their bikes, a little bit like the uniform and things like that we provide people support with, we're going to hopefully recycle the bikes there. And the last slide from me is the next one, I think, and it just touches on one of the other offers as well, which haven't got enough time to talk about, but it offers adult cycle training. It's the Bikeability program. The opportunity, and this provides people and adults, children, with the opportunity to access bikes even now to learn how to ride in the future. We'll have the availability on our Facebook page, so you don't need to have a bike, but also this happens in schools. And if you are part of a school or you have a child that goes to school and you think actually they don't know how to ride or they'd like to learn to ride, every school within the city can access Bikeability training. And we also have half-term activities, which one of the posters on this slide suggests as well, I assume.
Sorry, I was just going to say, because I know there's so much information, so sorry, we are trying to share a lot of information and I know there's a full agenda. So, I mean, I think what I'd just sum up with is if people have any questions, queries, please get in touch. We're really keen to work in partnership with others in the city, and we're happy to answer any questions outside of this webinar as well.
Thank you, Michelle and Megan, that's brilliant, thank you. And as you've just said, so much information about the work that you're doing, how you're approaching communities to use physical activity as a vehicle to hopefully reduce inequalities and to get people out of their homes, which I think is just so important at the moment. And one of the biggest things we've found in our surveys as well is that social isolation. So that's key to this. And physical activity's got a massive role to play there, whether it's individuals or families together, as you've talked about.
Absolutely.
So there are so many different things that you can get involved with, and you can signpost the communities that you're working with to do. So there's a couple of key things that were just mentioned at the end then as well. So there's the Bikeability training and the holiday activities that are happening, I think, next week. So if you're working within your communities and they're looking for things to do, then there's some options there. So as Michelle said, they're more than happy to take any questions or to be contacted for more information. So no, that's brilliant. Thank you both. That's great. Okay, so moving on. I'm conscious of time, so I think it's likely we're going to run over the hour that we had allocated, but that's absolutely fine. So as long as the speakers are fine to say, it doesn't matter in terms of recording the webinar or anything. Over to Sport Birmingham, and I'm going to introduce Helen Corrigan, who's going to take us through some of the work they've been doing and some of the opportunities they have for communities as well across Birmingham. So over to you, Helen.
Thanks, Stacey, and follow that. Thank you, everyone who's been before. And I suppose what I'm about to say is probably going to be quite complementary to a lot of the things that have already been mentioned. So first of all, I'm Helen Corrigan, Senior Partnerships Manager at Sport Birmingham. Next slide, please. Thank you. Yeah, so who are Sport Birmingham? We're one of 43 active partnerships, or what we used to be called sports partnerships a few years ago. So there's 43 of us across the country. We work collaboratively with local partners, national partners, really to bring inclusive and accessible sport and physical activity offers to communities. We use our insight as well as partners, knowledge and expertise to really support individuals, groups, sports clubs like the more traditional ones, or more your community organisations and those third sector organisations across the community. You'll have probably heard of Sport England. Sport England has been mentioned quite a few times today. So we are part funded through Sport England, and we take a lot of their national campaigns and bring them down to the local level as well, and really localise it for Birmingham using our own insight to really make it fit for purpose for the city. Next slide. So here's our vision for impact. We want individuals to be more active, healthy, happy, more successful, and communities stronger, more inclusive, more integrated and more resilient. Next slide, please. So yeah, there's lots of things that I could talk about today, but obviously conscious of time, and also what's probably more specific to today's webinar, and what's quite specific to COVID and the response that we've had over the last few months. So I'm going to go through some specific guidance, some of Sport England's campaigns around Join the Movement, our activity finder, some workforce opportunities for volunteers and coaches. So it's not just about how to be physically active, it's the other ways you can get involved as well. Talk about our Tackling Inequalities funding, which I know quite a lot of community organisations and clubs will be really interested in. And then just around our virtual community that we've set up during lockdown. Next slide, please. So it was quite frustrating. I pulled together this really detailed slide, and then obviously the tier alert system came out, so it was a quick change. So I've not actually put all of the detail around the tier system, just because anything could have happened in the last few days and Birmingham could have moved up or down. So there are 3 tier systems that the government have put in place. Birmingham is currently in tier 2. So I'm going to give a quick summary of what that actually means, specifically in the context of sport and physical activity in the city. So indoors, organised individual and team sports must be played by a single household or support bubble. Exemptions to this rule are under 18s and people with disabilities. Exercise classes can also continue as those larger numbers, as long as the venue is a sufficient size to cater for those larger numbers. However, people need to keep in those separate groups of up to 6 people. Informal sport can only be played indoors by a single household or support bubble. And obviously gyms and leisure facilities are open at the moment and keeping to their own COVID safety guidelines. Outdoors, national governing body approved organised team sports, exercise classes and outdoor licensed physical activity and sports participation events, they can happen in any number, again, as long as they follow their COVID secure guidance. So each national governing body of sport has actually been through like a really rigorous return to sport assessment. So this is including their action plans, their guidance, how they're demonstrating those mitigations to risk, how they've adapted their sports and activities. So if you do play a specific sport and you're unsure of what that means for you now, depending on where we are in the tier systems as well, please have a look on their individual website, as well as you can go on to Sport England and you can find links on the Sport Birmingham website that will tell you what you can do within that specific sport and activity. And then outdoors, the rule of 6 still applies to informal sports. As you'll see, there's a link there to Sport England's summary of what you can and can't do across the different 3-tier system. So please go on that page, how we can help coronavirus, really informative, and actually it really sets out what you can and can't do. Obviously there's so much information that's being pulled out at the moment, trying to keep up is quite difficult, so that's really useful. And what we have done in terms of supporting clubs, organisations, venues, really we put together a guidance document really just to help people make their activity, their space COVID secure. So it's a really practical guide around setting one-way systems, having contactless payment, booking online where you can, just some really fairly simple and straightforward to-dos really, and tips on just how to make your activity as safe as possible. Again, follow the link that's on this slide, and it's quite a detailed document as well. Next slide, please. So as I've already mentioned, Sport England, they've got a lot of campaigns going on. At the start of lockdown, they released their Join the Movement campaign, which was all about supporting people to keep active during the lockdown period at home or going outdoors, obviously keeping within the small household bubbles. So now, coming into the autumn and winter, we recognise that obviously it's even harder at the moment. Now the days getting shorter, darker, colder, rain, etc. So they've launched this autumn and winter activity toolkit. So when you do get the presentation, you can click on the hyperlink there. That will take you to that page, and it's just got loads of tips, links to other online platforms. A lot of them are free. There's quite a few that might be paid as well, but again, there's options there for people who do want that free access to different activities, to sports, again, both indoors and outdoors. Next slide. As I said, there's lots of resources that people can download. It's got different timetables, but two key campaigns that Sport England, that form part of Sport England's Join the Movement campaign, and some that people probably already heard of. This Girl Can. So that's been around for 5-6 years now. Quite a lot of people know of it. It's quite a well-known brand. So that's about targeting women of all ages to keep active, to get active. So you can, on Sport England's website, you can actually click on that icon there really, and that's a hyperlink to that specific page, and that will take you to different virtual sessions, different ideas for activities, and what there is locally for you. And then again, the We Are Undefeatable campaign, which is targeted at people with long-term health conditions and helping them to get active. So similar to This Girl Can and the whole Join the Movement campaign, lots of ideas and different ways that you can get active. And even as what's been said today already, just little things can make all the difference. So we're not expecting people to go from doing absolutely nothing to becoming an elite sports. That is absolutely not what this is about. It's just people starting to do something and try and build that habit, create the habit. Next slide, please. So on our website, so similar to Sporting, we've got our own activity finder on our website, as many providers have moved online during lockdown, which is great because it means that there's still the option to be active. This is more a localized activity finder of what people can find on their doorstep. So it is face-to-face, but also online. You can download on-demand videos around particular activities and sports, and you can also go on live sessions. So, and I do believe that the Active Wellbeing Society are on this activity finder too. So also, if you're an organisation, you can sign up to the platform if you're not already on there and you want to reach some new audiences. So again, go onto our website. That link at the bottom there, that should be /playways. But again, go onto Sport Birmingham's website and you can join as an activity provider, or you can go on as an individual and try and find an activity that is right for you. Next slide, please. So as I've said, there are workforce opportunities. So it's not just about getting involved physically, You can get involved as a volunteer, as a coach, and we provide a lot of those opportunities through our training. So in the past, we've always run workshops or linked to other providers that provide their own workshops. Obviously, a lot of things are still being run online at the moment, so we do have a lot of those links to the e-learning. We do actually have an e-license at the cost of £25 per person, but this gives people access to 18 courses, so really good value for money, and particularly those people that might be starting out as a coach or volunteer and want to just get a lot of knowledge, build up some minimum operating standard qualifications as well. So that, again, go on our website, you can find information about that, or email me following this presentation. We do a lot around recruitment and deployment opportunities. So we have people can come to us looking for volunteer opportunities, and then we'll do like a matching service. So we work with clubs and organisations who might say, look, we're looking for X amount of people to come and support us with a particular event or a weekly session, etc. So we'll do that matching up. We also do recruitment campaigns, so where we've had big events come to the city in the past, so where you have the women's tennis that takes place at Edgbaston and Priory, we've helped with some of the volunteering opportunities around that. With the World Indoor Athletics a couple of years ago, we supported that. So there's a range of ways you can get involved as a volunteer, and we can support with those deployment opportunities. We do a lot around mentoring, one-to-one, group mentoring, and also then linking organisations and individuals together so that they can talk. So rather than it being led by us, actually people learn from very like organisations, so we can facilitate that. We do a lot around club development and organisational development, so where organisations, particularly at the moment with the situation, there's a lack of funding and resources coming into the system, we can support people with that. And I will go on to a funding opportunity that we've got on at the moment following this slide. We can support with organisations just enhancing their experience for participants as well, how they can promote themselves better. So we provide some online social media training as well. So there's a real range of ways we can support clubs and organisations. And then we use a lot of research and insight, and something that we developed a few years ago, the Birmingham Way. A few people on this call will know about that. And that really has provided like a base for a lot of the ways that we work and we deploy our workforce, and we engage volunteers and coaches in the community, and how they're like inducted into being a coach and a volunteer in the city. Next slide, please. So yeah, the funding that I've just touched on at the start of lockdown, obviously that had a massive impact on community organisations and clubs for various reasons, and a lot of obvious reasons. So Sport England developed a support package. This was totaling £210 million, and their specific tackling inequalities response fund totaled £20 million, which is national, the national amount. What we found that at the start of that lockdown period, that there were certain priority audiences that were disproportionately affected by the by coronavirus, and this absolutely widened those inequalities socially and in general life, but then obviously in sport and physical activity too. So those outlined priority audiences are those listed: low socio-economic groups, minority ethnic communities, people with disabilities, and people with long-term health conditions. Next slide, please. So this fund that we've got on offer, I'm not going to go through the detail of what you can and can't apply for, because again, you can go on our website. So it's for staffing, facilitator, etc. So I'm going to move on to the next slide, conscious of time. So we've just opened this fund. We have £110,000 available for the city, grants of up to £4,500. The first round has just been opened, as I said, and this is focused on people with disabilities and long-term health conditions. And the deadline for that is the 6th of November. And then following that, we'll have a second round that will open up to all of those priority audiences that I've talked about. Again, you can find the guidance and application form on our website. And if you move on to the next slide. And probably linked to Tackling Inequalities funding, we have our virtual community network that we formed during lockdown, but we're going to continue. We feel it's been one of the best things we've done in terms of connecting with our community organisations. And this has just been about bringing those clubs, organisations together to share experiences with like-minded organisations, network, identify potential opportunities to work together. And next slide. And so we've had 3 sessions so far, and we've got our 4th one tomorrow. So this has been about adapting your organisation and the ways you work through coronavirus, operating safely and returning to sport and physical activity, planning for the future. And then the one tomorrow is actually a more detailed session on the Tackling Inequalities Fund that I've just touched upon. So if you want to find out more, please join us for that session, and you can book onto that event via our website. Next slide, I think that's the last one. Yeah, so that's me done. Thank you very much.
Thank you, Helen. Thank you so much for that. That's great. And again, so much information there, and so many opportunities that we can get involved in. There's the national campaigns and the online resources that Helen mentioned, which are brilliant and so inspirational for people that maybe you can share with the networks that you're working with too. The other thing that Helen and Michelle both mentioned is support available to people running sessions within the community. So advice on COVID safe guidance, either for the sports clubs or for community providers. That's a really useful tool and resource that's out there. So if you're aware of people that used to run sessions and maybe have stopped during COVID, and maybe you're unsure why, or maybe they want to get more involved, then there's the advice and guidance there for them, which will help get things back up and running when they feel safe to do so. So moving on now, thank you, Helen. Moving on now to Claire Williams. So Claire's from Transport for West Midlands, and she's just going to talk to us about walking and cycling and Roll and Stroll, which has been a great initiative that's been running this summer. So Claire, over to you if you're with us.
Yeah, hi everybody. Thank you so much for having me. I'm going to take you on a whistle-stop tour of our Roll and Stroll campaign. I do work for Transport for West Midlands, but I must point out this is a massive team effort and involves many people across the region, I think some of whom have been on the call today or are still here. So the West Midlands, we have got historically low levels of cycling and walking. We've already had some stats today, and you know, we know that we need to do something to activate the residents that tell us that they want to do more. There is definitely an appetite, and during lockdown we saw significant increases in the number of people who are both cycling and walking more. Okay, next slide please. So over at Transport for West Midlands, we are concerned with creating a network to allow people to travel. And as part of that network, cycling and walking fit in. And you will see there what we have badged the Starley network. And the Starley family, for anyone who doesn't know, are a Coventry-based family, and they were pioneers of the modern bicycle many years ago. And so we've named our network after them. You'll see on this map in front of you, there are plans to create a real great infrastructure for people to be able to cycle and walk safely. We know that people would love to do more cycling and more walking, but perhaps the infrastructure is not quite up to scratch, and people perhaps don't feel as safe as we would like them to. Okay, so we've been developing these plans for the last sort of 5 years or so, and you'll see there it's not just Birmingham, so our work spreads across the region, and we cover 7 local authorities. But I must say you're very lucky in Birmingham, because you have by far the most support and activities that are available to residents. And we've heard about some of them this morning, which is absolutely fantastic. Okay, moving along. So at the beginning of May, feels like so long ago now, but at the beginning of May, Grant Shapps, Secretary of State for Transport, appeared on our television screens at one of the coronavirus briefing sessions to tell us that the government were going to invest money into cycling and walking. And the reason being is that throughout lockdown, we have had various messages, but ultimately telling people to use public transport for essential travel only, and we have seen a significant decline in the number of passengers that have been using public transport. And as Kim mentioned earlier, also people choosing to use private motor cars because they feel safer. So our job is to encourage and to get people cycling and walking. And we were lucky enough to be given some money out of the Emergency Active Travel Fund. So tranche 1 is what we delivered over the summer, and we've delivered 59 infrastructure schemes, which is the bulk of the work that we're doing. That's across all the local authorities. You might have seen these in your local area, pop-up cycle lanes and various modal filters. All that means is let's slow the traffic right down in neighbourhoods and give local people their streets back. So, you might have seen some planters that's stopping up the ends of roads into the estates, etc., reducing rat running. And I know in Birmingham they do some great work with school streets, so closing the streets near to schools at particular times of the day. Absolutely fantastic, lets our kids get to school safely. Other things such as pavement widening because of social distancing, and in Birmingham city centre developing the traffic cells initiatives. So loads of things going on. 23 miles of routes have been put in. And we've also put in other things around signage, cycle parking, cycle counters. So any of this, if you spotted it, it's been delivered locally by the council, but is part of this bigger project. Thank you. Next slide. Okay, so there you go. That's just a plan showing you that in a more graphical way. And you'll see there that Birmingham is sort of at the centre of all that, and it spreads out to our neighbouring authorities. Okay, so throughout all of this, we've been really keen to engage with communities, and communities can get involved in looking at the plans, commenting on the plans, telling us what they think by visiting our online portal, and you'll find the link to that on our website, which we'll share. But basically, we are really trying harder to engage with the people who are going to be ultimately to make the most of their investment in our area. Okay, next slide, please. And now, of course, you can build it. Will they come? That's a really interesting question, and we think, and I know this view is shared by lots of colleagues on this call today, that we need to activate this infrastructure. And we've already heard from Megan all the great work that Torves are doing in Birmingham, but we've also used some of the funding to activate some of the projects you can see on your screen. So Love Your Bike is all about enabling people to get their bikes, get them to a certain standard, cycle them safely, get them security marked, buy a subsidised lock, and get them back out and about on their bikes. You'll see over there on the right hand side, there's also loads of different initiatives that we've been funding. And like I say, these are not delivered necessarily by us, but delivered by lots of different organisations and fabulous people across the West Mids. Just zooming in on a couple, we've already talked about social prescribing today. We've got some of that going on. We've got some adapted cycling going on at the Midlands Mencat Park Ride, which is absolutely amazing. I went out to have a look at some of those sessions. It's great to see. And we've also been working within businesses and universities to think about commuter travel and how students are actually travelling around. Loads of other stuff. I haven't got time to go through it today, but there is loads going on. Okay, next up. Okay, so it's a bit of a busy slide, but basically what it's saying is that we have an active travel partnership, and we've been able to expand some of the work that we've been doing with our partners. So Cycling UK, they operate across the region, including a brilliant officer in Birmingham, and they organise the Community Cycling Club. We also have British Cycling working to deliver Go Ride, Let's Ride, Breeze Ride. So all of these things, all about activating cycling, totally complementing all of the work that we've already heard about today. And there at the bottom, Living Street. So we've got project officers across the city. They're working in schools. We know that parents want their kids to walk and cycle to school. We've got stats galore. And how can we enable that for them? So we've got some great officers working in schools and giving out badges and really trying to encourage school children and their parents to walk. We've just done something new. Amongst all that text on your screen, you might pick out that we've started something called Little Feet. That's brand new, bit of a pilot to see whether we could influence preschool parents to start active travel early. So that's something we've just started, and we'll come back with some interesting results, I'm sure. Okay, next slide. So you hopefully have seen some of our comms. So all of the things that I've spoken about have been backed up by original comms campaign. These are the characters that we've chosen to use, hopefully injecting a bit of fun, you know, a bit of action and physical activity during these strange times. So the idea being that we were promoting not just the infrastructure, all of the measures that we're doing, but also some behavioural change lifestyle campaigns. So you can see it, share it. We're going to be running it through the winter. Obviously, we're going to change the messaging, and we want to get more people rolling and strolling. Okay. We aim to reach those people who have the most to benefit. I think every speaker said that this afternoon. We're particularly interested in, you know, communities that don't necessarily have access to or traditionally take part in our activities, and we're really trying hard to do that and be as inclusive as we can. Okay, next slide, please. So what are we doing next? Well, we're currently waiting. We're in that period of time where we're waiting for the government to release some more money. So unfortunately, everything's sort of centred around funding, but we did put in a bid for nearly £14 million to carry on doing some of this work through to the next financial year, so through to March. So we put together more on the infrastructure, so 37 more schemes. And then we'll also do all the wraparound services that I've spoke to you today. We have also included an additional scheme, which is exciting, the West Midlands Cycle Hire project, which will see hire bikes appear on our streets very soon. And we should hear back from government by the end of October. So every day I'm checking my inbox. We will need to have this delivery committed by 31st of March. So this has been a real challenge for us to roll out these things quickly. And I think we've done a good job in getting these things out and into the communities as quick as we could. Okay, so my last slide is asking you guys to get in touch. We need to get more people involved. There's a few ways you can do that. So if you are an organisation and you are interested in getting your employees, your students, your communities more involved in the work we do, you'll find this in need of support box on our website. Click on there, request support for your organisation, and we will be in touch. Or if you just want to have a look at some of the plans for the infrastructure, for the new path, for the new pop-up cycle lanes, etc., you will find a link for a Have Your Say portal. We've got the maps on and all the things that you can interact with. So those are the two main ways to get in touch. And if you are a partner and you'd like to get involved in another way, please feel free to just send me a message and get involved. So thank you so much, and that's me done.
Thank you very much, Claire. That was a really brilliant presentation just to finish off with. And it just shows how much work is going on across Birmingham for people to get involved with, whether it be structured activities, online things, support for the workforce, or walking, cycling, and the infrastructure side of things. There's just so much out there that hopefully all of the people that will listen to this that are working with their community organisations really have things that they can signpost to. I suspect that there's been so much information in this that it won't be until later when people start to listen and digest that there's they have lots of questions. So I think at that point, if you're listening to this after the webinar and you have questions or would like to get involved or more information about any of these things that you think are particularly relevant to any of the community groups that you're working with, then either drop an email into the Healthy Brum email address and we can connect you to the right person in the right organisation, or if the details are in the presentation, contact them directly. They'll be more than happy to connect with you. So I think just moving on, I think in terms of questions, I think there have been a few in the chat that have been answered already. So I think we'll leave that for people to email in further questions. And I think that just leaves me to give a really quick mention to the COVID Community Champion programme that we're coordinating. So you might be able to push this out through the organisations that you're working with, or the ones that you or the communities that you're working with too. So can we move on to the Community Champion slide, please? Thank you. So COVID Community Champions we're trying to build a network within all of the communities in Birmingham. The idea being that we can get the up-to-date information to them. It's up to date as we send it out, and it's the right information about the current restrictions, current opportunities for people, and it's just helping to get the right messages out there and break down some of the mistruths that are on social media. So if you can promote that within the networks that you're working within, that would be gratefully received too. Thank you. And then I think just moving on to wrapping up, like all of the webinars, we welcome people keeping in touch with us. We want to do as much as we can to reduce the inequalities across the board, but you know, in relation to physical activity participation as well. Sorry, I'm being called. So yeah, online you'll find there's the Be Healthy handouts. There's the full list of webinars, so you can listen to the webinars that have happened, and you can listen to the ones that are planned as well to take place. There's 2 more left. So yeah, I think that's all from me today, and a really, really big thank you to all of the people that have taken time to support this today, pull together the vast amount of information that's been discussed through the last hour or so. So thank you, everybody, and yeah, we hope you have a good afternoon.
Thank you, Stacey. Thank you, everybody else.
Thanks, guys.